Today we have Dr. Erin Haynes from the University of Cincinnati. Dr. Haynes, could you explain a little bit about some of the research you have done recently on the issue of health and hydraulic fracturing?
Yes, so fracking is a big issue, particularly in Ohio. And the community members actually came to me and asked, what can you have to help us? They said, with fracking, because we have so many questions and we don't know what to do about it. So I went immediately to the literature, which is where where scientists go to look for what existing data, what studies were out there. And there was very, very little at the time. This was maybe 5 years ago. Now there's many more studies. So we do know more. But what we have done with them is to, one, do a formal informational needs assessment with collaborators at University of Rochester and UNC Chapel Hill. And myself, we've each pooled together from our centers and asked the question to key community members what their issues were or what they thought were the upcoming research needs, so that we had a solid research agenda. And they let us know that air and water, seismic activity was a big concern in Ohio, along with the excessive traffic that they were experiencing in Ohio. So we began with a research study on air quality. And we wanted to measure what was the air quality like around in the residential areas around fracking wells. And this was a collaboration with Cincinnati, myself, and in Oregon State University.
What were some of the biggest health impacts that you did find with hydraulic fracturing?
Well, so far we've not conducted a health study. We've simply collected data about the environment. What is present? What chemicals are there? So now that we know what chemicals are there, we can move forward.
And what are some of the chemicals that came out in the highest levels from some of these activities?
Well, the study that I did with Oregon, Dr. Kim Anderson and Dr. Laura Kinsel from Oregon State, we looked at PAHs. So within the PAH mixture, we looked at PAHs, and PAHs are polycyclic aromatic hydrocarbons, and they come from combustion products. They come from natural and man-made items. They're everywhere, and we looked at. We analyzed for over 60, and 32 were detected within the samples.
And so at this point, we don't know if there's any direct health impacts, but we do know that there are quite a few chemicals that are produced as a result of these activities.
Yes, so we're finding out what the chemicals are, and then we know that they are connected with cancer, and they are also connected with respiratory illness.
What can legislators learn from scientific researchers and the academic community about not only this, but other environmental health issues?
Well, that's a good question. There are many environmental exposures related to fracking. There's occupational exposure, the workers who are there, they are closest to the action, so to speak. There's the schools. Many well sites are being leased the land for the public schools. In some cases are being leased for wells. So that begs the question, well, what about exposure to the kids and the teachers and the staff who are at these public schools? So we as scientists can help shed light on the issues and the actual exposures and potential health effects by summarizing the literature and then providing it in a very easy to understand type of a fact sheet summary information to help inform policy.
Who funds your center? How are the academic researchers supported?
So all of our funding comes from the National Institute of Environmental Health Sciences. So we have a Community Outreach Engagement Corps, which I direct, which has been on the forefront in Cincinnati, with issues related to fracking, because again, it came from the community and they wanted this topic addressed. So all of our funds come from the NIEHS.
And under this funding mechanism, how do you determine what issues are you going to address?
My area of research comes from the community. So what are the issues the community members are struggling with? And we go back to the literature and we say, well, here as scientists, this community of scientists does have an answer about X. We know what the causes and what the exposures are, so here's the data. But in a case like fracking, we still don't know all the answers. So more research is needed. Because
you get your scientific research queries from the public.
Yep.
Do you are these very relevant to some of the most pressing issues that are coming out today?
The community, they have their hand on the hot button of what is the big topics of the day. So fracking came up actually from the community before scientists were hitting it.
Can legislators contact these centers to get more information?
Absolutely. I think that would be a fantastic idea.
That sounds great. Thank you very much, Dr. Haynes, for joining us today.
Thank you. It was
at
a
the
pleasure.
National Conference of State Legislatures.
Thank you.